Who should get Botox? You can start getting Botox as early as your 20s or 30s. It's not a problem because in that way, you're already starting to prevent the wrinkles that people who are already in their 40s and 50s may already have. But if you're in your 40s and 50s, or even in your 60s or 70s, you also can come on in order to start getting repair of your skin. Depending on when you start will depend on how much medication that you may need in order to get the best look for you. So come on in, schedule your appointment as early as possible. We look forward to taking care of you. So number one, as you're going into your first Botox session or your next Botox session, your provider is going to kind of ask you some common questions. Like, what are the areas that trouble you the most and how much treatment do you want? So some common areas that I tend to see a lot with patients are here on the forehead, in between the frown lines of the face, some of the crow's feet on the side, and even these gummy smiles. So with that being said, depending on how much units that you'll use, you can kind of get an aspect where the muscle won't move at all, giving you a nice flat skin area, or you may get some that has a little bit of motion. At my point, I have a nice little stagnant line here through the edges that I really want to heal. And so I'm going to really make that muscle kind of really go to sleep for the next 3 months. So I'm going to use a considerable amount of tox in order to get that muscle to relax. So stick around while we kind of go through our... What are some things that you should not do after getting your neurotox treatment? You should not go and start to massage or rub on your face. You should not go and start doing any sweating. No strenuous exercise or working out. No sunbathing, which may enhance the sweating. You should also not go and lay down immediately. And when you do lay down, we encourage that you lay flat on your back, not laying on one side of your face or the other, or laying face down in your pillow. So number one, big tips for coming in for your first time doing Botox. Number one, the biggest conversation that you want to make sure that you're having with your provider is, how do I get the best results? A lot of people sometimes want to come in to only treat one area, not realizing that if you only treat this area and not treat the opposing muscles at a different area, you'll get a different result. So what we often will tell patients is that when we're treating, we need to kind of make sure that we have both areas that oppose each other treated. The next aspect is, how much motion do you want in your muscles after treatment? Some people still want to have a little bit of a natural look, so when they move their forehead, there's still a little bit of motion that you'll see in the muscles or some of the lines and wrinkles that you may still see in your expression. And some people just want to have a very nice flat skin at that area. So making sure that you're setting the right expectations for yourself to get the best results.